Hello, my name is Dr. Joe Toscano, and I'm running for a position on the Board of Directors of the Urgent Care Association of America. Over 10 years ago, I had the very good fortune to meet Lee Resnick, David Stern, and Bill Meadows when they were searching for partners for the formation of this very organization. As a young whippersnapper, I have to tell you, it was like meeting Benjamin Franklin, Thomas Jefferson, and James Madison. At the time, I was working with the American Academy of Urgent Care Medicine, which had been in existence for a little while longer and had been doing fairly well. But the vision of these guys, along with John Kaler, was amazing to me, and their ideas for the formation of an organization were unparalleled. Management at AAUCM did not recognize the value at the time, and though others and I worked for over a year to obtain some kind of formal collaboration, it was not meant to be. The rest is, as they say, history. The explosion in the specialty in the industry, as well as growth of this organization, has been phenomenal. It's been very exciting to watch. The organization has grown due to the public's recognition of the importance of urgent care medicine, as well as the creative and entrepreneurial spirit of many people. That spirit has blossomed in both the provision of urgent care medicine services directly, as well as the ancillary and other support services which facilitate and advance the practice of urgent care medicine. There's been a well-earned bonanza for well-conceived and well-managed chains and networks of urgent care medicine, as well as urgent care specific EMRs and CME offerings, specialized practice management and malpractice coverage, as well as medical supply services catering to urgent care medicine specifically. As with most good things though, change is to be expected, and the current changes on the horizon include externally imposed expectations about what means quality and efficiency in urgent care medicine practice. It's no longer going to be entirely up to clinicians and to urgent care operators. What I'm seeing in my community and reading about nationally is that paradigms close to what are being applied to emergency medicine will be applied to urgent care medicine soon. These changes, or maybe challenges is a better word, are not all that bad when terms such as value, safety, and efficiency are being applied to them. It's just going to be harder for urgent care medicine to experience the unbridled growth it's enjoyed previously in this current environment. The true challenge is to engineer and mediate appropriate changes in clinical practice which are keyed to these new external expectations. We have to do this in a way that permits continued growth and profitability. This is important because the clinical practice of urgent care medicine is the financial lifeblood of the industry. Touching and treating patients is what generates income. Clinicians and operators will be looking to the Urgent Care Association of America for a roadmap to show them how to navigate this new landscape and these new constraints. What is the best approach to a patient with respiratory tract infection, cervical whiplash, a hand wound, chest pain or abdominal pain in the urgent care practice? What's the approach that maximizes cost and time efficiency, that results in the best patient outcome and patient satisfaction, and preserves and maximizes profitability? It's no longer entirely up to us. This is going to be a moving target, and we need to best reconcile the needs and perspectives of patients, clinicians, business owners, and those who pay the bills. It's never been more the case that the clinical practice of urgent care medicine is as important in defining the future of the specialty and business ventures in this endeavor. What's already happening in emergency medicine, PQRS, MACRA, MIPS, EDCAPs, and advanced payment models all incorporate external expectations to create formulas for reimbursement, again, the lifeblood of the industry. This has ramifications that spill over into the formation of strategic alliances, advocacy efforts for the association with legislators, payers, and employers, as well as outreach efforts for patients and the public in general. Because of all this, physician representation on the board is going to be very important to guide the direction of healthy growth for this organization. I'm a practicing emergency physician with a strong background and an ongoing strong interest in urgent care medicine. I have a knowledge of the history of the organization and its vision and founders. I'm hardworking and dedicated, and most of all, I'm a sucker for a good cause. Unfortunately, due to inauspicious timing, due to some meetings that I have at work, I cannot be in Orlando for the convention, but if all this makes sense to you, I'd appreciate your vote. I'd like to thank you very much for listening and for your attendance at the convention.